Consultant gynecologist.
Good afternoon, everyone.
Zion.
Zion,
We move,
Zion.
we fly.
I'm Dr. Elizabeth Uchechukwu Odo, and our topic today is causes of infertility and the way forward. Infertility is defined as the inability of a couple to achieve conception or get pregnant after regular unprotected sexual intercourse of 1 year duration. And infertility, it's a major issue. It has a multifactorial causes, and it has a social and psychological impact because high premium is usually placed on having children. And the causes of infertility, the causes of infertility can be primary, secondary, or unexplained, also known as idiopathic. Primary infertility is when a woman has never gotten pregnant before, while secondary infertility is when a woman has gotten pregnant before and then is subsequently unable to get pregnant. Unexplained infertility occurs when we do not know the cause of the infertility, when all the tests and investigations that have been done has not shown any reason or any cause for the infertility. The epidemiology of infertility, the male factor causes of infertility is about 40%, and also the female factor is also about 40%. Then both factors, male and female factors, and the unexplained causes makes up about 20% causes of infertility. So when I say the definition of infertility, I said is when a couple has not been able to achieve conception after 1 year following regular unprotected sexual intercourse. What do I mean by regular? That means that the couple should be having sexual intercourse at least 3 times a week. That is what we regard as regular intercourse, 3 times a week. So if you are trying to get pregnant, the partners, you must be meeting yourselves at least 3 times a week. So the causes of infertility, we have the male factors, the female factors, and then the unexplained.
Doctor, is that 3 times a week?
Yes.
Up to, is it?
That's the structural abnormalities include conditions like when you have uterine fibroid. Fibroid can be in a position where it can cause infertility. Like when you have submucous fibroid, when you have some fibroids that are in the endometrium, inside the womb where implantation should take place. If you have some fibroid there, submucous fibroid, it can be very small as 1 centimeter. Once it is in the endometrium, it can affect implantation such that implantation will not occur. And then when you have cervical stenosis, when the cervix is blocked, And the cervix can be blocked due to so many reasons. It can also
What
be...
is service? And where is the blockage?
These are parts of the reproductive system. It's a part of the reproductive system. Cervix is the passage.
Where are they passing from?
Okay, the female reproductive system. You have the external and then you have the internal. The external is the one that we can see outside.
Where is that place?
The external, you have the introitus, you have the vulva, the...
What is vulva? You have to teach people something. You have to know that you are speaking to some people who doesn't understand. If it's private part, call it name. That is how to teach people something.
Okay.
External ovinosis. How many of them understand what is a...
Okay. So during sexual intercourse, the penis goes into the vagina. It penetrates into the vagina to release the sperm. So during sexual intercourse, the penis goes into the vagina to release the sperm. Then the sperm is now transported through the cervix and then goes up to the uterus and then the fallopian tubes where fertilization takes place. So if you have any problem, any structural abnormality, it can affect normal transport and implantation. Then the other causes include the tuber blockage, fallopian tube blockage. Once the tubes of a woman is blocked, that woman will not be able to get pregnant. Because it is through these tubes, the sperm will be transported through the vagina, cervix, uterus. Then the eggs are released by the ovaries, then transported through the fallopian tube, and fertilization takes place in the fallopian tube. And before it is now transported back to the uterus for implantation. So if there's any tuber blockage, a woman will not be able to get pregnant. So other causes of tuber blockage include conditions like sexually transmitted infections like gonorrhea, syphilis, chlamydia infections, chlamydia infections. All these conditions, sexually transmitted infections and pelvic inflammatory diseases. These are the infections that will cause the tubes. It's like someone that has renal disease, chronic renal disease, some lupus erythematosus. All these conditions can cause infertility. Then for the male causes of infertility, now I have explained the causes of infertility for the woman. It takes a man and a woman to meet together for pregnancy to occur. So the main causes of infertility also includes conditions like structural. The main causes has to do with the semen, the sperm. The semen analysis, when it is done, the parameters must be okay. So the sperm must have good morphology. It must have good morphology. Then the sperm count must also be within the normal range. And the sperm must be active. It must be motile. It must be able to move. Not the sperm that that is dead that will not move. So the motility of the sperm matters. The sperm count is very important. The morphology is also very important. Then other causes includes varicocele. When you have the veins in the testes are congested. Then you have undescended testes. When the testes that should normally descend into the scrotum, when that does not happen and you have it undescended,
Gịnị bụ scrotum? Kọwara ha chọrọ ebe.
The scrotum is like that, the balls.
Which
The balls.
bulb?
The
Electric bulb.
males. In the males, those two balls that you usually see in men. So that's the scrotal sac. That's it.
So why I'm asking this question, but I want you to be explaining it to the language they will understand. Everybody does not understand scrotum. And that's why I'm asking you, many of them, why we brought you and we are going to bring others, is for them to really have the knowledge of the problem that some of them may not be able to afford to go. So bring the language, make it more explanatory.
All right. Okay.
More explanatory, right? That is the correct English, right? Make it more explanatory.
Then sexual dysfunctions, erectile dysfunctions, when the sperm is not able to ejaculate very well. So you have erectile dysfunctions. These are some of the causes. Then also for men, we have lifestyle, environmental factors too. You know, environmental factors can affect both the men and the women. We have environmental factors like chemicals, exposure to chemicals, harmful chemicals can cause infertility. Also toxins, chemical toxins. Then substance abuse. Smoking have all been found to be causes of infertility. Then lifestyle modification too. When either the man or the woman is obese, when you are obese, too much fat, your body mass index is very high. Or when you are also underweight, you don't have appropriate weight, the right weight for the normal hormonal functions to occur in the body. Then other causes too also include structural abnormalities. There are also men that have structural abnormalities. There are chromosomal anomalies, genetics. You know, some it's in the genetic system, and all this can cause infertility. In evaluation of infertility, it's very important for the couple to know that both of them are needed in the evaluation. And in the evaluation of infertility, it involves multidisciplinary approach, because the cause is what should be treated. So this evaluation of infertility, it involves taking a very detailed history. When a couple have infertility, they will go and see a doctor, a gynecologist. Then the gynecologist will take his or her time to take a detailed history from the couple, from both the woman and then the man. Take history and do examination. The doctor will examine the different systems of the body and also do a proper pelvic examination. The doctor will examine the genital area of the woman and do vaginal examination in order to pick up any abnormalities. Then after that, investigations are important. What are the investigations that should be done? For a woman that has infertility, the investigations will include a transvaginal scan. That's pelvic scan. A transvaginal scan is done so that they will be able to examine the structures, the reproductive structures, to see if there is any abnormality. And then ovulation hormonal profile is done. The hormonal test is done to check the hormones, the different hormones, to see.
And this is for a male or female?
For female. Yeah.
For female.
Yes.
You know, all these things, very soon now, she will stop today. You will now ask your questions. You know, some of women will allow some men will not want to go and check themselves. They will always ask the wife to go. And so that's many problems are from men. So, doctor, you are doing well. Corona more. Kube na kowe ofuma explanatory. Kowabe ofuma ki hesa banyani ife.
Okay.
Ewe nwete ifa na acho. Ole, what is the right time for a woman to take in if they are okay? The right time. After the ovulation, how many days? They want to know these things. They want to know, is it good to be sleeping a woman when she's 2 weeks pregnant, 3 weeks pregnant, 1 month pregnant? They want to know. Oh, these are a lot of things they will ask you. Oh, yeah, go wakatata, on off, bang off. If you claim your wife when you are 3 weeks pregnant, she may have miscarriage or not. I don't know. You teach them. All these things is the questions and answer. How many of you are ready to ask him questions? Ask our questions. Doctor.
Okay, so for the hormonal profile, we'll check some hormones. We'll check the prolactin level, luteinizing hormone, follicle stimulating hormone, progesterone, and testosterone. Some of these hormones, when they are in abnormal quantity, it can affect ovulation and the woman will not be able to ovulate. Then there are some women that have a galatoria. When they press their breasts, milk will be coming out. It is also a serious cause of infertility. And when you press your breast and you see a secretion of milk, discharge, it's important for you to see a doctor because it can also be a cause of infertility.
Give somebody a high ten if you are listening. No, but again on a 1 minute. Again, yeah, about couples program. All these small girls in our baby, I'm not even a bit shop. Yeah, Lenny. In our sister, and getting a cause of the weak erection. Odogu Kuroto Oda, Odogu Kuroto Oda. Why a number of fairy says, Kuliani Budikeo, Kuliani Budikeo, Kuliani Budike, Ieja, Manadikero, Odogua Potabononala. Ngene Butoja Potabononala. In the center of fire, Oda. We want Oruni Ruolo, Eja Luciolo, Odoguada. Why a number of faculty says, this is a here, Kowa Brim. Mbru doctor, mem of Makari and the doctor, you know what? I'm going to go ahead.
So the scan, then you also need a pelvic scan. The scan will show if there are uterine fibroids or other structural abnormalities. Now, some people have fibroid and they are still able to get pregnant. Some have fibroid and they are able to get pregnant. And some will have fibroid and they may not be able to get pregnant, depending on the location of the fibroid, where the fibroid is located and how big it is. Some fibroids can be very close to the tube, such that they will block the fallopian tube. Then some fibroids can even be in the lower segments, in the cervix. You have it down very close to the vagina. So when you have fibroids there, it will obstruct the flow of sperm. So the sperm will not be able to go up. So when a woman has infertility, has not been able to get pregnant, and has fibroid, it's important that that patient should also see a doctor. Then other investigations that needs to be done include hysterosalpingogram. It is a special test that is done to check the patency of the fallopian tubes. That test is done to show if the fallopian tubes are open. Then the other tests also include hysteroscopy. Hysteroscopy involves the use of a hysteroscope to examine the uterus to see if there are if there are structural abnormalities, or if there are polyps, abnormal growths, or if there are fibroids. The other tests that can be done also includes a laparoscopy. Laparoscopy is a minimally accessed surgery that we use to examine the peritoneal cavity to see if there are other problems. Then you also need blood tests to check the baseline function. You need to check the full blood count, the liver function test, and the electrolyte urea creatinine to check the kidney. Because abnormalities in these organs can also cause infertility. Then for the man, in evaluation of the man, what is very, very important is seminal fluid analysis. The man must go and see a doctor so that seminal fluid analysis can be done. In that seminal fluid analysis, we'll be checking the quantity, we'll be checking the motility, and we'll be checking the morphology. Then a scrotal ultrasound scan is also important for the man to check for varicocele. And for the man, there are some structural abnormalities like that varicocele that can be corrected by the surgeons, such as urologists. So at times when a couple presents for evaluation and the doctor sees that the man that the man is the one contributing to the infertility, the doctor refers the man to go and see the urologist, who will manage the infertility issues related to the man. So treatment, how do we go about in treating infertility issues? The treatment is based on the cause. It's based on the cause of the infertility, age of the patient, and the duration of infertility. Whatever is the cause is treated. If it is as a result of fibroid, the woman can go for surgery and do a myomectomy. That's the removal of fibroid nodules. Then if it is as a result of ovulation disorders, The woman can also be treated with some fertility drugs that can help to enhance ovulation. Then, if it's as a result of some medical conditions like thyroid disorders, the woman is managed with endocrinologists, the specialist in treating endocrinology disorders. So it requires multidisciplinary approach. But if it is as a result of blocked tubes, that is difficult to manage because the woman may need surgeries for the fallopian tubes, and the prognosis is not very good. But if it's as a result of blocked tubes, especially when the two fallopian tubes are blocked, then the woman may need assisted reproduction techniques. If a woman has one blocked tube, one blocked fallopian tube, and one is patent, she can still get pregnant and have as many children as she wants. But if the two fallopian tubes are blocked, it's difficult for the woman to achieve conception. And the different techniques in assisted reproductive technology, we have intrauterine insemination, we have in vitro fertilization. So when you meet your doctor will evaluate you properly and decide what is best for you. Prevention of infertility is very important. Prevention is very important. So how do we prevent some of the causes of this infertility? We can prevent them by good lifestyle modification, healthy feeding, eat good food, fruits, vegetables, exercise, avoid toxins, exposure to chemicals, avoid smoking, tobacco use, treat medical conditions appropriately, and then treat sexually transmitted infections and pelvic inflammatory disease. Prevention is very important, it's key. And to prevent sexually transmitted infections and pelvic inflammatory diseases, is advised that one uses a condom. But these conditions can affect the fallopian tubes. So whenever a woman is having symptoms, abnormal discharge, you are having chronic lower abdominal pain, it's important that you see your doctor so that your doctor can properly evaluate you and get you treated. Because sexually transmitted infections and pelvic inflammatory diseases can affect the fallopian tubes, and they have long-term complications. These are the conditions that will eventually cause blocked fallopian tubes. So in conclusion, infertility is a major gynecological presentation, and it has psychological and social impacts. It's a global problem, it's a global issue. And it's important that a couple that has infertility should present early for evaluation. Now, for a woman that is above 35 years, when you notice that you cannot get pregnant, you don't have to wait for too long. 6 months is okay. If you're above 35 years and you've been trying to get pregnant for 6 months and you are not achieving conception, don't wait for 1 year. Go and see your doctor so that the evaluation can be started early enough. And the management involves multidisciplinary approach involving the gynecologist, the physicians that will treat the relevant medical conditions, the urologist, and the psychologist. Thank you very much. So do you have questions?
My name is Onyechi Josiah Courage. I'm from Imo State, Mbise precisely. I just want to ask a question about the fallopian tube blockage. Okay, whereby if a woman have blockage of the tubes, like the two tubes is blocked, and at the end of the day, the woman do flushing, is it possible for a woman to still conceive?
If a woman has bilateral fallopian tube blockage, it's difficult for the woman to achieve conception. And she's advised to go for... Your partner also needs to be treated. Because if your partner keeps on going outside and keeps on reinfecting himself, you get treated, he comes back and reinfects you. So it's important that both of you should go and see the doctor and get properly treated. Thank you.
Ma, the water discharge, is this something that can be treated?
You also need to see a gynecologist because you are going to run a test. We need to check the serum prolactin level to see how high it is. And there are special medications that are used for treating that, which you have to take for a long time, like 6 to 8 weeks. So you take those medications, and after that, you repeat the serum prolactin test to check the level to see if it has been well treated. But you need to see a gynecologist. Thank you.
Zion. My name is Francisca Okuru from Ebonyi State. My question is, I want to know the reason why having intimacy with my husband, for once in my marriage, I've not been able to enjoy it, because each time after having an intimacy, it will look as if there's, once something is deposited in my body, it will look as if there's an iron. It will look as if there's an iron, as in the whole of my body, my tummy, my stomach will be itching me. So I don't understand the reason why it's happening like that.
Well, I don't know if you have seen a doctor, if you've seen a gynecologist. You need to see one, because if you are constantly having itching, then that needs to also be evaluated and then treated. So you need to see a gynecologist. Thank you.
Zion, my name is Ifoma from Anambra State. Please, I have a question based on ovarian cyst. When you were teaching, you talked on concerning fibroid, that the best way to manage it is by surgery, by removing the nodules. Okay, when it comes to ovarian cyst, what is the lasting solution for it? Because this is the problem I've been suffering for 4 good years. I got married now. I've been on medication for a good 4 years, both injection and tablets, but all to no avail. So last month, when I went for another scan, I was told that the results changed from ovarian cyst to left endometrioma. So what's the lasting solution to this problem?
Okay, for ovarian cyst, there are different causes of ovarian cyst. We even have physiological cyst. That's normal cyst that one can have with ovulation and all that. Yeah, but for your own case, you have a background endometriosis. Endometriosis is an important hormonal condition that can result in endometrioma, that's ovarian cyst. So for that, you also need to see a gynecologist who will evaluate you, because there are medications that they can give to help reduce the effect of the endometriosis. And the management will also depend on your desire for fertility and other things that you want. So when you see a gynecologist will review you and do serial ultrasound scan to see if the endometrial cyst is getting bigger. Because if it keeps on getting bigger and becomes very large, it can cause complications. You know, it can rupture, you can have torsion, you can have acute abdomen, which will be life-threatening. So you need to see a gynecologist to also manage that. Thank you.
Yes, based on seeing a gynecologist, we actually met a gynecologist that year, 2022, I got married. And he treated me for more than a year, but there was no result. So that's why I want to know the lasting solution to it. Because he kept on telling us that it will go on its own. But for 4 good years now, I've not conceived because of this thing. During ovulation, I feel the pains more than a week. The pains is so intense. So I can't even meet with my husband because of the pains. That's why I want to know the lasting solution to it.
Well, you can be treated, palliative symptoms. You can be treated such that the symptoms will be managed. And again, since you want to get pregnant, you also need to see a fertility doctor, because for the endometriosis now, you can be assisted with ovulation induction and timed intercourse for you to get pregnant. So you need to see a fertility doctor so that they can assist you in getting pregnant. Thank you.
Zion, my name is Amaku Zoma, and I'm from Imo State. So I gave birth 11 years ago. And since then, I've been trying to conceive, but no avail. So I've gone to so many gynecologists. I've seen private. I've gone to private hospitals, and I've gone to government hospital too. So they now say, and I told them I deliver with CS. They said I will go through HSG, and I've gone there two times, the different hospitals. So they say that my tubes are okay. At a point, they now say since I'm ovulating well, that they have to track my egg to know when to conceive, so that they will tell me the date that I will meet my husband so that I will conceive. So at the process, they told me that they did not see any egg to track, so that I did not have any egg. So I want to ask, is it possible that someone that have given birth before and your tubes are okay, all of a sudden you won't have any egg again? So that's what I want to ask.
Yeah, yes, it's very possible. And that is when you have a reduced ovarian reserve. Ovarian reserve reduces with age. So you need to do a special test that will test for the ovarian reserve. If the ovarian reserve is low, you may not be able to get pregnant easily. But you can also see a fertility doctor that can assist you. There are different ways to go about it in order to help you to achieve conception, and you'll be able to carry your own baby. So there's management for ovarian reserve. You can get an egg donor and all that. You just need to see a fertility doctor. Thank you.
Zion, my name is Gynecologist Prostrate. I'm from Imo State. Doctor, I want to ask, you made mention of a varicose. I want to ask, if someone does not want to go through surgery, is there any other way the man can be able to manage it in order to achieve conception? Then in regards to the question my sister that just left now asked, in terms of low air quality. What can be an easier way to improve the air quality? Thank you.
Okay. Yeah, for the management of varicocele, you need to see the urologist. They are the experts in that, in the management of varicocele. And that's why I told you that infertility involves multidisciplinary team approach. Whatever that is the cause, the specialists, the experts in that field will be the ones to manage it. So for the varicocele, the man needs to see the urologist. Then for the egg quality reduces with age. With age, and there are other things too that can affect the quality of the egg. Chemotherapy, radiotherapy, radiations, toxins, these are some of the things that can affect the egg quality. So a fertility doctor will also be able to assist in this regard. Thank you.
Zion. My name is Friday Anthony. I'm from Imo State. My question is, doctor, since I'm married since 2023 till now, even before then, my wife has been living with me. But because of that, this preaching, I have to raise money to go and do traditional marriage. So till now, there's no sign of baby. We have met doctors, both native and English. Even scientific hospital here, I met a doctor there. So all the whole things that they are precaution they give me to be taken, both English and native drugs. I've taken everything, and they are even telling me to avoid so many things. And what I will eat more, most fruits, banana, cucumber, walnut, and most of all those fruits. I've ate, but still I want to test. And there's no, even the result went lower than before. What can I do again?
I will advise you to see a fertility doctor. A fertility doctor, a specialist, will be able to help you better. A fertility doctor will be able to help you because a proper evaluation will be done, and then we can explore other avenues to help you. Thank you.
My name is Okeze Amarachi. I'm from Abia State. So, doctor, I have not been able to conceive or be pregnant before until last year I took in. But the baby, the embryo stopped growing, and I was told to evacuate it and try for after 3 months. And I've been doing that since then, and I have not taken in again since then. And the doctor said that I'm okay, my womb is okay, there is no blockage of any kind. So, what could be the problem?
Well, we have to keep on trusting God. If the doctors have evaluated you and there is no cause, then lifestyle modification, just take folic acid, vitamin E, vitamin C, and then continue. Hope for the best. And I will advise you that as soon as you get pregnant, as soon as you meet your doctor, make sure you go and register with the specialist so that they can help you to support the pregnancy and do everything possible to keep the pregnancy. Yeah. Thank you.
Zion, my name is Chidima from Imo State. Doctor, please, I I was expecting to hear from you about inability of seeing your monthly period in a girl of 16 years or 20 years. Please, what could be the problem and what's the solution, please?
Yes, are you talking about a girl of 16 years old that has never seen her menses?
Yes, she has been seen, but it comes and stopped, it comes and stopped. Till now, she's 20 years and it's not coming anymore. So I want to know.
Yeah, it could be an ovulation disorder, which I explained. It could be endocrinological disorder such as a polycystic ovarian syndrome, which comes with irregular periods like that, and period of amenorrhea. So she still needs to see a gynecologist that can help her better. See a gynecologist.
Zion, my name is Isabella Ezenwa. I'm from Imo State. My question is, doctor, can bilateral ovarian cyst cause infertility?
Yes, it can. Bilateral ovarian, depending on how big the cyst is and the type of cyst that it is. So you need to see a doctor. Because
does it have any medical treatment? Or
does it have
any medical remedy?
Well, the patient will be evaluated, and so many things are put into consideration in managing this patient. You need to know the type of cyst, the duration, the size. The size of the cyst is very important, and the type. Is it a cyst that has benign features or malignant features? All these are very important, and that's why you need to see a gynecologist to help you better. Thank you.
Zion,
Fly.
my name is Juliet. I'm from Cross River State. My question is, after meeting with my husband, normally when I stand up, the sperm will just pour out. And I've gone for a test. The day I went to collect the results, the doctor was not around. So I don't know what is the cause. And another question is, for someone that has low sperm count, what can he use for treating it?
Yes, depending on the cause of the low sperm counts can be treated. And there are some drugs that have been found to be very helpful. And that is the reason why when you see the doctor, they'll prescribe those medications for you. There are medications that have been found to help. You know, you can use antioxidants have been found to help in mopping oxygen radicals. And it can improve sperm count. And there are some other medications too that have been found to be very useful. So when you see your doctor will prescribe these medications for you or for him. Thank you.
Thank you, doctor, for your teachings today. My name is Mary Cynthia Anozie from Imo State. Doctor, I want to ask, I got married 2013, I took in 2014. On the line, I had miscarriage. And since then, I have not conceived again. And I developed high prolactin. On the prolactin I used to see my menses every month. I used to see my ovulation every month. And since then, I have not conceived. I want to ask, what is the problem?
Yeah, the problem is already, it's also there. You said you have a high serum prolactin. Has that been treated? That's hypoprolactinemia.
Yes, I have treated it, but it's still occurring.
If it's still occurring, then you need to go back again. No, you need to be treated until the level drops and goes within a normal range. Yeah, because it can cause ovulation disorders and all that. So that needs to be sorted out. It needs to be treated. So I'll advise you to see your gynecologist. Thank you.
My name is Okori Objageri. Doctor, please, I want to ask, after meeting my husband, the sperm will be pouring. Is it necessary? And what is the best treatment for low sperm count? We did tests. The first one showed 1, but the other one showed 0. What is the best treatment for the watery sperm?
As I've told you, like, if you have some parameters, it's unfortunate, there are some parameters that are really very poor. And just as when you have azoospermia, there are some men that there's no sperm at all. Do you understand? So you need to still see the doctor, see the urologist. The urologist will evaluate the man to know the cause. If it is as a result of a structural abnormality, if it is a problem that has to do with transportation or blockage of the epididymis, vas deferens, then the urologist will know and then do something about it. You particularly need to see the urologist.
Zion, my name is Ugona Joy. My question is that since on 2018, I gave birth to my child, and the child died 2 years. So after that, nothing showed again. So I was going from one place to another, drinking medicine, doing so many tests. They will tell me that I have PID. They have treated the PID, treated. Later, the infection will still come back again. So last month, and I go back to the same hospital that I did operation. They gave me tests with my husband. We have run all the whole test. The doctor refused to explain the test for us. He only told us that he placed us on some medication, injection, and drugs. We collected injection like 1 week, 7 days, me 7 days, my husband 7 days. Okay. So since that last month that we take that treatment, he now placed us for another medication, fertility drug, a ransom drug that we should be buying it in pharmacy. But when I asked my doctor, what is actually wrong? Maybe, is it me that did not have a womb, or my husband cannot be able to pregnant woman again? The doctor will now say that I have PID and he has treated what he see. Okay, since when my husband started using the drug, my husband cannot be able to stand up again. So I want to ask, what will I do for this kind of case?
I will advise you to go and see the urologist. It is the urologists that are experts in managing male infertility. When the problem is with the man, it is the urologists that are the experts in managing this case. So I will advise you to go and see the urologist. Usually, if you see a gynecologist and then you have been properly evaluated, if there is need for you to see a urologist, the gynecologist will refer you to the urologist. So the gynecologist can refer your husband to the urologist for proper treatment. Thank you.
Okay. Zion, my name is Grace Nwogbodo. I'm from Ebonyi State. Doctor, I want to ask, does fallopian tube blockage makes it impossible for cervical mucus to come out during menstruation?
Repeat your question again.
I said, does fallopian tube blockage makes it impossible for cervical mucus to come out during menstruation? That's the egg white, this thing that comes out during menstruation.
You can still have it coming out during menstruation. But the point is, if the tubes are blocked, if the two tubes are blocked, it's difficult for conception to occur. So that's what you have to know.
Zion.
We fly.
My name is Angus from Anambra State. Doctor, I have 3 questions for you. The first one is that a woman that have a fibroid and went and meet a consultant, a gynecologist, and now examine her and told her that she will go for surgery. Then after the surgery, and she cannot be able to conceive. What is the issue? So that is my first question. Then the second question is that you have a lot of grammar. You are narrating us about gynecology, homocology, and urology. So, you talk about homocology span, and that word was very strange to my ear. So I want you to to divide to me in an oral interpretation. So, and the last question I want to ask is that you talk about STD infection, that it can affect a man that cannot able to pregnant a woman. So in our society, this infection is very rapid. So and here in Nigeria, 65% of drugs we sold in Nigeria, from my own observation, they are inferior, they are fake. Some people have that kind of a situation, and they went to meet a physician or a gynecologist, and after the examination, they went to treatment, and the medication or the drug that we give them will not be effective, and some people will be running around. So, and for my own observation, I found out that the 65% of drugs are inferior. So, what are we going to do in that situation?
Okay. Concerning your first question about the woman that had myomectomy, yes, it's been found that myomectomy can improve the chances of conception, but at times, because of the fact that there are different causes of infertility, so even after that, a woman may still not be able to get pregnant, and that is why evaluation should be done by the gynecologist, so that if there are possible causes that have been seen, those causes can be treated. Now, concerning pelvic inflammatory disease and sexually transmitted infections, yes, these are common, and that is why it's very important to keep to one partner, keep to one partner. Now, in management of sexually transmitted infections, there's what we call syndromic management of sexually transmitted infections. What it entails is that there are some symptoms that naturally a woman will present with. Even before doing investigations, you start empirical treatment, you start giving some drugs, and there are different types of drugs that are given. There are some special types of drugs that are given to manage some sexually transmitted infections that you may not even that when you do tests, you will not see those organisms. So those drugs are given to help in managing STIs and PIDs, and it's usually when you see a gynecologist, a qualified gynecologist, they know what to do. They'll be able to manage it better. Then concerning fake drugs, I'm aware that there are pharmaceutical shops, there are chemists that still sell original drugs. So you just have to make sure you go to a place where they sell good drugs and buy the original drugs. Thank you.
Please, if you have questions, you can still come out.
Zion, my name is Ogechi Ezak. I'm from Anambra State. Okay, doctor, I want to ask, is it a must that every woman who finishes seeing her period, then while she's on her ovulation, must she see a slippery cervical mucus during her ovulation?
Okay. Sorry, what's the question again?
Every woman who finishes seeing her period, then while she's on her ovulation, must she see a slippery cervical mucus? Is it a must?
Well, it's not a must, if you put it that way. Do you understand? It is not a must. And seeing that mucus and appreciating it, it's very subjective. So it's very subjective. So the important thing is to also do some other tests, hormonal tests, and to ensure that the woman is actually ovulating.
Zion, my name is Agudeni Gwestella Okawaka from Enugu State, Maritimo State. My question, I have 3 questions. Okay. The one question I have, Auntie, please, can you tell me what could be the cause of someone not seeing her period 3 times or normal as is supposed after going to several tests and treatments, and after that the ovulation, she will not see the ovulation, but immediately after the period, like a day, then she will be having abdominal pain, very serious abdominal pain that can even be doing as if she's having first trimester of a pregnancy. Then the other question.
So you are talking about chronic pelvic pain. Chronic pelvic pain is an important gynecological presentation, and there are many causes, different causes of chronic pelvic pain. So it's a gynecologist, a properly trained gynecologist, that will be able to evaluate and know the likely cause and then treat. So it's important that you see a gynecologist, because a gynecologist will take a proper history, examine you, do pelvic examination, and when they do all, and then request for some investigation. So when they do all these things, they are able to have some results, and they will now correlate the clinical findings with the investigations and then give you the best treatment. Thank you.
Zion.
Hey.
Zion.
We move.
My name is Jim Michael from Anambra State. Doctor, I have 3 questions to ask. 1, what is the reason for a sperm to mix with urine? Number 2, what is the reason for a man when having an intercourse with his wife, the sperm will stand erect but cannot produce sperm, as if the man is sterile, but in a dream world, the sperm will pull out? Number 3 question is, doctor, you said one of the factors for infertility is congenital factors. So I was listening with rapt attention to hear what you said there until it was intercepted by an evangelist.
Okay. Okay, thank you for your question. Yeah, the causes could be due to structural abnormalities. Structural abnormalities, something that has to do with the structure of the different organs and all that. And that's why you need to see a urologist. Because a urologist they will examine you. They know how to examine that private part, that penis and everything. They will examine it very well, and then you will do some tests. You do some investigations. You do scrotal scan, you do other tests, hormonal tests, and you do other tests. And whatever that is the cause, what they have found out, they will explain to you. If it is the one that they can correct through surgery, they will tell you to come for surgery and it will be corrected. And if it is the one that they cannot do, that is a genetic or congenital, they will let you know. But they are the best people to evaluate you. And even if they are the ones that they cannot correct, there are other options. There are different options, other things that can be done to still assist in conception. There are other things that can be done to help you. Thank you.
Zion, we move. My name is Leticia Udoka from Imo State. I want to ask, doctor, what causes a woman, when a woman see her period this month, and the period runs very well, like 3 days, then next month, the woman will not see her period again. And after that, upper month, the woman will see her period, and the period will run like 5 to 6 days. I want to know, and another question, a woman seeing her ovulation, and they see ovulation coming out, and other woman is not seeing her ovulation coming out. When you went to see the doctor, when the doctor ran the text, and the doctor said that your body was okay. I don't know. I just want to ask.
Now you are talking about abnormal uterine bleeding. That's what we call abnormal uterine bleeding. And there are different causes of abnormal uterine bleeding, ranging from structural and pathologic, and can even be idiopathic, that is, you do not know the cause. So you need to see a gynecologist, because from what you've said, abnormal uterine bleeding, one common cause of this is also polycystic ovarian syndrome. A lot of young women in their reproductive ages actually have polycystic ovarian syndrome. So you need to see a gynecologist. A gynecologist will properly evaluate and then determine the exact cause, and then you get treated for that. Thank you.
Zion.
We move.
My name is Tansi Ede. I'm from Ebonyi State. Doctor, you mentioned some things that can cause watering sperm and low sperm count, like alcoholic, tobacco, and smoking. I want to know, and infections too. I want to know if a man not drinking alcoholic, smoking, and tobacco, and he meet doctor, the doctor treated him infection, and the things still happen, like getting watering sperm and low sperm count. What is the cause?
You are asking for the cause. Cause of a low sperm count. There are different causes. Do you understand? Just as I've explained to you, there are different causes. You can have genetic causes. You have medical conditions can cause. Medical conditions, hormonal disorders, hypothalamic disorders, pituitary disorders, disorders that affect the brain, how the brain works and sends signals to other organs of the body. And it is in seeing a urologist and doing the proper evaluation, then you'll be able to determine the cause. So I'll still advise you to see a urologist. Thank you.
Zion, my question is, my name is Ozamaka Iboke from Ebonyi State. My question is, doctor, I go lab S3, for fallopian tube, all the lab, but I don't see necessary thing anymore. All necessary for infertility, no show. But if I meet to my husband, I see something pitching my tummy, so I don't know what is cause.
Sorry, I didn't get your question. Did you say that the tubes are blocked? No. The tubes are patent?
No. I go any necessary line for fertility, but none is good. But if I meet to my husband, something is pitching my movement or my tummy, so I don't know what is causing.
Yes. All the tests are okay, but when she meets her husband, she'll be having these itches around her tummy.
Body or my tummy, so I don't know what is causing it.
Well, you still need to see a doctor. You need to see a doctor because a doctor will take a history, examine, and then evaluate and take a decision. It's difficult to tell you, just say what it is now without proper evaluation.
Zion, my name is Chineyen Naji. Doctor, you talked about lifestyle modification and you talked about weight. So what is the actual weight for a man and woman, mostly women, that want to conceive? So what is the actual weight for that woman?
Okay. Yeah, when we talk about weight, we use what we call body mass index. And in using this body mass index, it involves checking your weight and then checking your height. So your weight in kilogram divided by the square of the height in meters will give us the body mass index. The normal body mass index is between 20 to 24. Some will have a 19 to 24, 25, yes. So when you calculate your body mass index and you get a number that is within 20 to 24, that means that your weight is okay. So the body mass index will now be categorized into normal body mass index. Then you now have overweight, then you have obesity, then you have pathologically obese, morbidly obese. That's when the body mass index is more than 40. Now that body mass index is an objective way of assessing obesity, and we know that obesity, that's when a woman is overweight. When a woman is overweight, it can affect ovulation. It can cause hormonal disorders. And it has also been found that women that are trying to get pregnant that are obese, it's been found that when they lose weight, about 5 to 10% weight reduction, it helps in ovulation and can also improve the chances of conception. So if you can check your height and check your weight, you can calculate your body mass index to know if it is normal. Thank you.
Zion, we move. My name is Ike Lilian Chigemezu. I'm from Enugu State in Suka precisely. My question is, doctor, what is the causes of, after meeting my husband, that means after 30 minutes of meeting my husband or 20 minutes, I'll be having peptic hotness in my VG. Like the place will be very, very hot, and like they pour pepper in my vagina. I cannot, the pain is too much. I don't know what causes it.
You also need to see a doctor, a gynecologist, because dyspareunia, that's a painful sexual intercourse. there are causes of sexual painful intercourse, and painful sexual intercourse, dyspareunia, is also associated with some conditions. It's associated with some conditions like endometriosis. So it could be that you have a background endometriosis and all that. So that's why you need to see a gynecologist so that they can evaluate you properly.
Zion, my name is Joseph Ugochukwu. I got married some years ago. Within 2 to 3 months, my wife, she conceived. And since then, we haven't got another child. My daughter, she's now 8 years. We went to a doctor. Then they said that she had fallopian tube blockage, which we did. And there's no result. And I also went for sperm count. I think I got up to 90-something%. But since then till now, there's no any result.
Okay, you said that she has a tuber blockage.
Fallopian tube.
Yes, fallopian tube.
And she did it. We went to hospital to treat.
And they said they are blocked.
Yes.
They are okay.
Yes, it's blocked. Then they treated it. It's okay now. Since then, no results.
Well, the treatment, we have to be sure of what it is. Because if the tubes are patent, once they are patent, conception can still occur. So if tubes are patent, conception can still occur. And if you have, because this is now a case of secondary infertility, and when you wait for too long and all that, you can actually meet a fertility doctor, especially if you have the means. You can meet a fertility doctor and they can help you in achieving conception. A lot of people are getting pregnant through assisted reproduction techniques. It has actually helped so many families. So you can always meet them.
Zion.
Move.
My name is Ugu Levenens from Enugu State. My question, doctor, is can hypertensive drugs cause poor erection in man? Hypertensive drugs like nifedipine, indapamide, and lisinopril.
Yes, antihypertensive drugs have been found to be associated with sexual dysfunction, erectile dysfunction. It can actually cause them. It can cause them, especially alpha-metidopa. They can cause erectile dysfunctions. So you can see your doctor so that they can review the medications and change them to the ones that are more friendly, that will not give you erectile dysfunctions, but they can cause them. Thank you.
Zion, my name is Jude from Benue State. My question is, if a man has weak erection and is taking some drugs to boost his erection before meeting his wife, will he be able to impregnate his wife?
There are so many things that will help in achieving conception. Because supposing the erection is okay and the seminal fluid analysis parameters are not normal. If they are not normal, conception will not occur. So you still need to see a doctor so that they can check all those parameters and ensure that they are okay.
Zion, my name is Nwodome Elijah from Ebonyi State. Doctor, I want to ask this question. Can somebody have sugar in body impregnating his wife after taking medicine? And another one, in 3 days before my wife will see menstruation, all your body will be fire. It will be crying, below. We see, I will carry her to hospital. They do scan, everything. The doctor will say there's nothing inside the belly. You should have no problem. But you see the crying, it will be too much inside her body. So what could be the cause?
That's dysmenorrhea. When your wife is having such symptoms, the best thing is to take her to the hospital so that they can help in relieving the symptoms. There are drugs that they give that will help in relieving the symptoms. I think there's another question. What's the first question? Sugar, yes. Diabetes. Diabetes mellitus is a serious medical condition that affects the different systems of the body. It has long-term complications, and it can also be associated with infertility. So it's therefore important that people that have a diabetes mellitus, that they see their doctors, endocrinologists, that will manage this condition. It's a condition that can be properly managed. People live with diabetes mellitus even to old age, to 70 years, 80, 90. The important thing is for the condition to be properly managed, for it to be within control. If the sugar level is within control, the complications associated with these conditions will be reduced. So it is managing these conditions that will help to generally improve the condition of the patient, but it can be associated with infertility.
Zion, my name is Confidence Obina. My questions goes like this. Doctor, you do mention of factors that affect infertility. I want to know, can family planning affect infertility? For instance, maybe you had it when you are still young, you are not married yet. Can that affect it? And again, when I was in school, they taught us that people that are trying for, pregnancy, maybe they should try when they are menstruating. So we all know how irritating that should be. So I want to know, how good and hygiene can that be when we are menstruating? We should have sex or have intercourse with our husband, enable for us to conceive. Thank you, ma'am.
Yes, thank you. During menstruation, you cannot get pregnant during menstruation. Do you understand? During menstruation, you cannot get pregnant during menstruation, because for menstruation to occur, what it is showing us is that ovulation has occurred and there was no pregnancy. So since there was no pregnancy, the endometrium there's shedding of the endometrium. And that is what is giving that menstrual flow. So meeting your husband during menses is wrong timing. It's wrong timing. You cannot get pregnant during that period. You cannot get pregnant. So then the family planning. Family planning is meant to help to prevent pregnancy. So there are different forms of family planning. There are some family planning that you will use, and when you stop it, you may not get pregnant immediately. But after some times, the hormones in the body will regularize and conception will now occur. Do you understand? So that is what happens. So when you remove the family plan, it may take a while for your body to regularize and for conception to occur.
Zion, my name is Rose Mondefaira. I'm from Akwa Ibom. Doctor, I want to ask you a question about my husband. My husband paralyzed for a good 7 years. Everything about him is weak. Is it able to conceive again?
Okay, everything about him is weak. Well, that may be, you would still need to see a gynecologist, because that seminal fluid analysis is very important. That is the test they do with men's semen. Because that semen, there are some criteria, basic things that you should have. The parameters should be within normal range. Like you are looking at the morphology, the form, is it okay? You are looking at the motility of the sperm. Are they active? Are they able to swim and move? If they are not able to do that, it will be difficult for the man to impregnate a woman. And then you're also looking at the sperm count. If it is very low, very, very low, or there is no sperm at all, lesospermia, it may be difficult. So you still need to see a urologist. And again, too, even when you see a urologist, for low sperm count, assisted reproduction techniques also help, because you can do intracytoplasmic sperm injection, ISCI. Is a form of IVF that can be done for men that have low sperm count for conception to occur. Yes, that can be done. Thank you.
Zion.
We move.
My name is Mary Onineshi Osigwe. I'm from Imo State. Doctor, okay, I would love to ask if there is a certain age in a woman that affects ovulation, like ovulation disorder. Is there any certain age in a woman that affects ovulation, that a woman won't see her ovulation again? Then you mentioned some factors that affect infertility. You mentioned chemical factor, then substance toxics. I would love to know more about that.
Yes. Concerning ovulation, as a woman is advancing in age, the ovarian reserve is reducing. But the ovarian reserve differs in different people. There are women that maybe 37 years, you may see a woman of 37 years and she still has good ovarian reserve. Whereas you can see another woman that is 30 years, she may have poor ovarian reserve. Do you understand? So it depends, the body responds differently. But at a particular age, menopause occurs averagely among the blacks, averagely age of 51, 52, 53. Some people would have attained menopause. So once a woman gets to menopause, the ovarian reserve drops. In fact, no more ovarian reserve, and the woman will not be ovulating again. But you see some women, they'll still be ovulating 55. There are some women 55, they'll still be ovulating. Now once a woman is ovulating and still seeing her menses, conception can occur. But if a woman has that problem, ovulation disorder, she can still be assisted to get pregnant.
Zion, my name is Victor from Benue State. My question is that in a situation whereby as a man you went for the medical checkup and the doctor found out you have a low sperm count and prescribed some drugs for you to take, after you taking it for a while, still there's no difference, what can you do? And another question is that in a situation where we say a man has already pregnant his wife and later he found out that he has a low sperm count, what can cause it? And you are not taking any hard drug or substances, what can be the cause?
Yeah, there are different causes, and that is why some people may have normal seminal fluid analysis in the past, like 10 years ago. But when they check now, it will now be abnormal. There could be different reasons. Toxins, like chemicals, benzene. Men that work in factories where they produce chemicals, they can have a lot of exposure to chemicals. Chemicals constantly coming in contact with your body parts, that can affect it. Then another thing again is exposure to heat. And especially men carrying laptops. You see men, they'll carry laptops on their laps for a very long time. Exposure to different forms of heat can affect the sperm. So that can cause it. Then drugs, medications that the man may have been exposed to can also cause it. And of course, age. Just as a woman is getting older and is going to menopause, it's also applicable to men. But just that with men, the effect is less, compared to women. So it's applicable. And in such a situation, the man can be assisted with assisted reproductive technique. In the situation of low sperm, the couple can go for IVF and they will do intracytoplasmic sperm injection. They will just, under microscope, they will take that sperm that is normal. They will check it under microscope. They will check the morphology and see that it's in good shape. And they will check to see that it is motile, it is moving. That one that is normal, they will take it and fertilize the egg and the woman can get pregnant. Yes, so if that is the problem, just meet a fertility doctor. They will help you. Low sperm count. So as long as something is still produced, conception can still be achieved.
Zion, we move. Doctor, my question is, my name is Indidi Igwe from Ebonyi State. My question is, 2019, I conceived. My 6 months, 7 months, blood start come out. I go hospital, doctor confirm say my baby grow inside womb. After tell me like that, they say I cannot born my baby myself. After tell me like that, I said the operation I go do for me before I was born. After operation, since then I don't see my period again. I go hospital, different cases, different stories they tell me. I don't know, I don't understand.
That is quite unfortunate. Sorry about that. But you still need to see the gynecologist so that they will evaluate and know why it is so. Because the truth is that a lot of people have infertility issues, and almost like 70% of them, they don't get to do HSG. It is when they come to us and we say, go and do HSG, we'll just find out that the two tubes are blocked. And once the tubes are blocked, there's no need wasting time again and all that. Just go for IVF and get pregnant. So you need to be properly evaluated. A lot of things could have occurred after the cesarean section. There could have been complications, after the cesarean section. Infection could have set in. A lot of things could have occurred that may have affected the tubes and all that. So just see a gynecologist.
Zion, we move. My question is based on, my name is Ngozi Simeon. I'm from Imo State. My question is based on fibroid issue. I heard that maybe does fibroid based on age? Is there an age you can get to have a fibroid? And again, when you find out you have a fibroid, like uterine fibroid, is it advisable or healthy to have intimacy? And does a long-time fibroid result to cancer?
Okay, good. Uterine fibroids, they are benign tumors that are very common among the blacks. A lot of women have fibroids. For some, it's an incidental finding. It's when they go for scan and do scan that they will notice that they have fibroids. So a lot of women have these fibroids and they are still able to get pregnant and have their babies. And some are still able to have all their babies with these fibroids. So it's quite common. Now, fibroid causing infertility depends on so many factors. It depends on the location of the fibroid. It depends on the size of the fibroids. Do you understand? There are some fibroids that are very dangerous. That fibroid may be small, but when it is in the wrong place, the woman will be having issues And that's the one we call submucous fibroid. That one that is usually in the endometrium. When the fibroid is in the endometrium, the woman can be having menorrhagia, heavy menstrual flow. Every menses, she will bleed and bleed, though. She will become so weak that you need to be transfusing her. Anytime she's having her menses, she will lose so much blood and she will be taken to the hospital to be transfused as a result of the menorrhagia. That is submucous fibroid. And in such a situation, it has now affected the quality of life of the woman. So, intervention, something should be done about the fibroids. Now, the fibroids, depending on the location, for some fibroids, it can be blocking the tubes such that the woman will not be able to get pregnant. So, if a woman has a small fibroid and it is not disturbing her and she's having her babies, she may not bother about them. But the moment they start affecting the quality of life of the patient, then something needs to be done. And there are different ways that these fibroids can be managed. For some, there's what we call medical management. There are some drugs that you can give that will help to reduce the blood flow of the fibroid. There are some drugs that you can give that will help to shrink the fibroid, especially if they are very big fibroids, so that when you give those drugs, they shrink the fibroid, then you can now operate on them. Then, there are some fibroids that can end up becoming cancerous. That's the one you call leosarcoma. So fibroids can, about 5%, 2 to 5% can end up becoming malignant. And that is why when a woman goes for myomectomy, that's a surgery, fibroid surgery, whatever that is brought out from that woman's body will be sent for histology. They will take it to the lab so that the special doctors, the histopathologists will study it and tell us the nature, if it is benign or if it is cancerous. So some fibroids, very small fibroids, can be malignant. Thank you.
Zion, my name is Oluchi Chinwoke from Ebonyi State. My question is that early last year, I took in. So after like a month, 2 months, then I had a miscarriage, but the thing refused to go. So when I go to the test, they say I should go for evacuation so that they can promote it. So when we reach there, after done everything, but since then I have not conceived. And whenever I have sex with my husband, as well as immediately the sperm drop, my body will be so hot to that time. If I didn't go to toilet so that the thing will come out, I will not get myself. And then secondly, doctor, sorry to ask this. From beginning, he said that couples should have sex at least 3 times in a week. Does it mean that having sex every day in a week, does it mean the remaining days is a waste?
Okay. Yes, for this question, that is why a woman must know her ovulation period. Do you understand? You must know your ovulation period. And if you don't know, if you meet, especially if you don't know, if you meet your doctor will explain it better to you. If a woman has regular menstrual cycle, that's 28-day menstrual cycle, and it is regular, a woman that is trying to achieve conception, it's important that she has a calendar. She should keep record of her menses so that you can be able to determine the ovulation period. Now, if a woman has a 28-day menstrual cycle, then it's assumed that ovulation will occur around the 14th day. Do you understand? It's assumed that ovulation will occur around the 14th day. So because you are not sure of the exact day that ovulation will occur, so we can say, okay, maybe it occurs around between the 10th to 15th day. Do you understand? So what it means now is that if you meet your husband between, let's say, 10 to 15 day or to 16 day, that is the period that ovulation is likely to occur and chances of conception will be higher. So you must know your ovulation period, do you understand, to be able to achieve conception. Then any other question? Okay, the 3 times in a week. Yes, the 3 times in a week, it's important. Because what it means is that if you are having a regular intercourse with your husband and you are having at least 3 times a week, then the chances of having sex during ovulation period will be very high. Do you understand? So the chances of having sexual intercourse during the ovulation period will be very high, and that will increase the chances of conception. So that's why we said regular unprotected sexual intercourse at least every 3 days. Every 3 days, 3 times in a week. If you want 4 times, you can do 4 times or 5 times, but at least minimum of 3 times a week.
Okay. Zion, we move. My name is Ukungunenna. I'm from Enugu State. So I took in 4 years. After 4 years, I have my first son. So after then, after 3 months, I have miscarriage. Then, since then, I cannot be able to conceive. On last year, before December, I went test. Doctor said that I'm having having a hormonal imbalance, and I'm not ovulating. Yes. So on this year, first week of May, I took in again. I don't even know that I am pregnant. I am 1 month pregnant. So before I know it, sickness came everywhere, from one sickness to another. To the extent of I'm starting having waist pain, leg pains everywhere. So to the extent of that, I cannot be able to walk. After 1 month, I have miscarriage again. So after that, then I'm not begetting myself. Even the waist pain is not stopping until I'm not be going from one hospital to another. Until 31st May, Daddy now mentioned my name, calling my name. So my question is now, can somebody that is not ovulating can get pregnant?
The good thing is that at least conception has occurred. You are getting pregnant. Now, when you are having recurrent miscarriages, that is a problem. So you need to also see your doctors so that they will evaluate you properly to know the causes of those recurrent miscarriages so that they can be treated. They can be treated before you get pregnant again. And as soon as you miss your period, especially if you've been having recurrent miscarriages, then it's very important that you see your doctor. As soon as you miss your period, see your doctor, because there are some medications that they can give you to help to support that pregnancy. And it also depends on the cause of the recurrent miscarriage. Like if it is a mid-trimester pregnancy, maybe if it is occurring as a result of cervical insufficiency, that's a weakness of the neck of the womb. If that is what is causing it, there are interventions that can be done. They can do cervical sacrilege. They can, suture the neck of the womb, close it, so that you will not have the miscarriage. So it's important to see a gynecologist so that they can evaluate for that cause of the miscarriage. And as soon as you miss your period, go and see the doctor so that they will help you. They will give you support, give you drugs that will help to support the pregnancy, and then manage you properly. If you need bed rest, they will admit you and then manage you and all that. So I wish you all the best. I just hope you get pregnant again.
Zion,
Move.
My name is Comfort Nwamba. I'm from Ebonyi State. My own question, doctor, I conceived in 2020. I conceived 2020. Since that time, I know having another one. As I'm standing here now, I dey have stomach problem. As I'm standing here, my stomach dey hot, and something go dey waka inside my stomach. Sometimes it go dey do me like na water, then they pour me inside me here. As I'm standing here now, I'm 1 month pregnant, and the thing started again. I go scan yesterday. The man tell me say I won't have the miscarriage again. And I don't waka, I don't know what I go do again. As I'm standing here now, na solution I dey find. And the man wey do me scan tell me say the blood still dey inside womb. And na solution I need. I dey find solution.
Okay. Yes, you need to see a gynecologist. Sorry, did you say that you were pregnant recently? Now, you are pregnant now?
Yes.
Oh, if you are pregnant, that's fine. Congratulations. Go and register for antenatal care.
Wetin happen be say the man say I won't have miscarriage.
Okay, you have miscarriage.
And this time wey I notice say I get pregnant.
All right,
if I dey like this, I go dey feel like I won't see my period. That is why, and the thing where dey hot inside my stomach, dey cause am.
Okay, there may be retained products of conception. That's if you were pregnant before and you had a miscarriage and you still have some retained products of conception, that can be a problem. You also need to see a doctor so that they can do manual vacuum aspiration, do the necessary things so that you will be okay, and also support you, assist you in getting pregnant. But you need to see a doctor, a gynecologist, because if you have retained products of conception, then you need to do an MVA, manual vacuum aspiration, to remove those retained products of conception, because if they are there, they can cause infection, they can cause endometritis, and it can even make it difficult for you to conceive again. It can make it difficult for you to conceive again, so you need to see a doctor.
Hello, Zion.
Move.
My name is Eze Amaka. I'm from Anambra State. Doctor, I have a question. I've been married for 3 years now. But my doctor said, when I visit a doctor, he said I am having a hormonal imbalance. And since then, my doctor have been treating it. He get to a point, the same doctor asked me to go and be praying that is not physical. And my second question goes like this. I don't know how to calculate my ovulation because sometimes my period falls during 21 days and sometimes it falls 25 days.
Yes, they're having a hormonal imbalance. Hormonal imbalance is a serious condition, and a lot of women in their reproductive ages actually have a hormonal imbalance. And that is why you need to see a doctor so that hormonal profile can be done. When that hormonal profile is done, it's able to tell us the type of hormonal imbalance that you have. And the other ones, other causes of hormonal imbalance can be treated. When this hormonal imbalance is treated, it increases your chances of conception. And when the hormonal imbalance has been treated, then the doctor, a fertility doctor, can still assist you to get pregnant by what we call ovulation induction and timed intercourse. You are given some fertility drugs that will help you to ovulate. Then we do follicular tracking. When you are ovulating, you'll be doing ultrasound scan to monitor the follicles. Then when it will likely rupture during ovulation, they can tell you the time to meet your husband. That will increase the chances of conception, assuming that every other thing is fine, assuming that the tubes are not blocked. So you can do ovulation induction and timed intercourse. But you need to do this with a gynecologist or a fertility doctor. And at times, this ovulation induction and timed intercourse can actually be repeated. So people do it the first time, it will not work. They can do it twice. It will work. For some, it may be the third time that it will just work and it will work. So you need to meet a gynecologist that can assist.
Are you learning something? Huh?
Zion.
We move.
Okay, good evening, doctor. My question may look irrelevant, but my name is Queen Wikiri. I'm from Rivers State. My question may look irrelevant, but I want you to bear with me and answer the question for me to achieve a purpose, my coming to the Zion. If one is sick, for example, you have a stroke, you have a swollen leg, or you are infected, or you have a disease, where is the best way to go for treatment? Where is the best way to go for a treatment? Secondly, as a medical practitioner, if apart from like blood transfusion, kidney transfusion, is it advisable if someone is sick, you are sick or you are ill, for your fellow human being to be drilled in such a way that they will remove fluid from you, from any part of your body, and transfuse into the sick person? Medically, is it wise? And does it have any medical effects on the person they are drilling? I don't know if you understand my question.
After this, for how many people are there standing now?
Okay. The first one is again.
How many people? After these 6 people, nobody should come out again for question. After those 6 people, we can also do the spiritual one. And give somebody a hot high pen. No, piase yi ke piase. Ni mechara dime. Mesie yi ke another hot high pen. Help me to tackle that person. I mean, if you tackle that person, you will receive miracle. May Madu 1,200. If you tackle, you will receive miracle. May Madu stand up for 2 minutes. Tackle everybody. Tackle everybody. You know, biara tata, but lesson and prayer. I say, Toko, The Lord bless you.
Amen.
In Jesus' name.
Amen.
Sit down. After these 6 people, no more questions.
Okay. Yeah. Zion, my name is Elobie Vincent. I'm from Enugu State. This question has been asked before, but the way the person asks it, I don't know, maybe the doctor just get it right. The question is, if somebody is menstruating, at the same time, can that person be pregnant or conceived? Reason for this is we've already had a lecture on this during my course for my marriage. One of the tutors said she used herself as an example that we should be having sex, no spare time, as in all the time, not the one that doctor just prescribed that we should use maybe at least 3 times in a week. We were advised to have sex all the time. That is by the way. Now, she used herself as an example that she can only conceive if she has, or maybe if she happened to meet with her husband during her menstruation. So, was she telling us lie then? Doctor, I don't know the way you can address the question.
Okay. 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 Yeah, to answer the question of the other woman, when you are sick, the best place to go to is hospital. When you are having stroke symptoms and symptoms of stroke, go to the hospital. Go to the hospital. A good hospital that know what they are doing. That is the best place to go. Because we've seen cases where people will have symptoms of stroke, high blood pressure, and all that. They won't go to the hospital. They will tell you that if they go to the hospital, it will become worse. That is not true. The best place to go is go to the hospital. That's where you get the best care. Then in terms of fluid being removed from the body, the different organs of the body, there are some places in the body where you will have fluid and it will be a source of harm to the patient, and it's not good for the patient. If such fluid is not removed, then it can worsen the medical condition of the patient, such as when you have fluid in the lungs, in the chest, pulmonary edema. That fluid needs to be removed. It needs to be removed. If it is not removed, the woman will have difficulty in breathing and will go into respiratory distress, and the woman can die. Then, if you also have excessive fluid in the abdomen, that's ascites, depending on the cause. Ascites, there are different causes of ascites. So when you have fluid in the body and you go to the hospital, the doctor will evaluate to know what is causing the ascites. There are some ascites, a distended abdomen that some people will have. It may be TB. Tuberculosis causes abdominal ascites, and it's even the commonest cause. So for such people, it's only when you go to the hospital and they evaluate you, they'll find out that it is TB. Immediately, you start taking the medication for tuberculosis, and they remove the fluid that is in the chest and in the abdomen. You start recovering. If somebody has tuberculosis, if you like, go anywhere you go. Once they don't give the medication for that tuberculosis, it's difficult for the person to get well, because there are some particular drugs that are used in treating tuberculosis, and when you give the drugs, the patient starts recovering. So other things. So it's better you go to the hospital so that the doctors will treat you and do the necessary things.
Zion.
We move. Okay, then the other question, it's a question on during menses and having sex during getting pregnant during menses. Well, you have to know your body, know your system very well. But the fact still remains that conception occurs during ovulation. Do you understand? So some people may have irregular menses, irregular menstrual periods, so they are not really able to tell when ovulation is occurring because of irregular menses. So for such people, they may say, okay, anytime, you don't know when ovulation will occur. But pregnancy occurs during ovulation, when a woman has ovulated. Because the egg needs to be released. It's when the egg has been released that it will meet, that the sperm will meet the egg, and fertilization will take place. So if the egg has not been released, how will fertilization take place? So the two must come together. Egg and sperm must come together, be fertilized for conception to occur. It does not occur in isolation. Thank you.
Zion. My name is Ohanoka Ogochukwu from Imo State. My question goes like this, concerning men. About prostrate. Because many men, they suffered for prostrate. What could be the cause of prostrate? And is there age, like the age a man will reach and have prostrate? Or can it happen to any man?
Yeah, thank you. Yeah, prostate cancer and prostate enlargement, it's very common. It's very common among the blacks. And a lot of men end up with prostatic hyperplasia and prostatic cancer. And that is why it is now very, very important that men go for routine checkup. Because once a man is above the age of 40 years, he's advised to always check the prostate-specific antigen, PSA. So you'll be checking the level. You have different normal values for different ages. So if a man has been going for routine checkup and the doctor finds out that the prostate-specific antigen has started increasing, then the intervention will occur early. But a lot of men live in denial. Do you understand? They live in denial. There are men that will go for this prostate-specific antigen and it will be markedly elevated, almost 1,000, that you are already sure that you are dealing with a case of prostatic cancer. But they would live in denial. The doctor will advise them to maybe have a prostatectomy, do a surgery where the prostate will be removed, prostate gland will be removed, to reduce the tumor bulk, that thing that is causing the cancer, to remove it and everything. But a lot of men, some men will refuse. They will live in denial. They will tell you it is not my portion. Or they will tell you that once they remove the prostate gland, that they won't be able to perform sexually again. So it's important that men go for this routine checkup, because when they go, it will be detected early and it will be managed, instead of waiting for it to now become advanced and they now have a metastasis. Then the tumor would have spread to the bone, to their chest, to the brain, and they start and they become very sick. So prevention is better than cure. And as a man is getting older, the level of the prostate-specific antigen actually increases. So you have different values of prostatic-specific antigen for different ages. You have different values for different ages. So it's important that men go for checkup. Thank you.
Zion, my name is Mrs. Chizoba. Doctor, I want to ask a question concerning you mentioning facility doctor and gynecologist. We are used to that name, gynecologist, but this facility doctor you are mentioning, who are they? Where can we meet them? It looks like maybe they are more knowledgeable than the other ones you are mentioning, the gynecologists them. So where can we meet them? Who are they? I don't really understand that side. Thank you.
All right, okay. Thank you. The fertility doctors are also gynecologists. It's gynecologists. In gynecology, we have different units, and there are subspecialties in gynecology. We have gynecology. We have gynecologists that are well trained in cancer cases. They've been managing cancer cases. They have managed so many cases, and they are better. They know how to manage cancer cases better. Then we have some gynecologists that have picked special interest in reproductive and endocrine medicine, reproductive medicine. That's this medicine related to reproduction, fertility. And these doctors, some of them have even gone for more training, specialized training. Some have traveled abroad, and some have gone for more training, and they are the fertility doctors. So they are gynecologists with special interest in reproduction. And some of them have fertility centers where they have helped so many women to achieve conception, because they do it over and over again. So they've been able to gather experience, skills. They've done it so many times, so they do better. So they are more proficient in managing infertility issues. So, and then we have doctors, the other ones that fetal-maternal medicine, gynecologists that are more trained in managing babies in utero, carrying out tests to know how babies are. So we have quite so many of them around available, and they will be able to help better.
Zion, we move. Doctor, my name is Chizoba Ajebo. Doctor, I want to ask, if someone did operation fibroid, can person see her period again?
Yes. If someone has done myomectomy, myomectomy is a conservative surgery in the sense that the uterus is preserved. The fibroids are removed and the uterus is still left there, so that the woman will be able to carry pregnancy. So if a woman has done myomectomy, she can still see her period. But there are different in myomectomy, endometrium. We have there are some fibroids, such as submucous fibroid, that may be in the endometrium. That's in the endometrium where implantation takes place and where the embryo stays and starts growing. So if the endometrium has been breached, that means that the endometrium, the surgeon entered the endometrium during surgery. If the endometrium has been breached, then it needs to be well repaired. There's a way the endometrium is repaired for those that are very good, that are skilled in carrying out abdominal myomectomies. So there's a way it is repaired so that endometrial tissue can still be preserved. Then after the surgery itself, there are measures, there are things that can be done to also help preserve the endometrium to prevent Asherman syndrome. Asherman syndrome is when a woman does not see her menses again. So some of the things that are done after the surgery, especially when the endometrium has been breached, includes passing intrauterine catheter. There's this small Foley's catheter, pediatrics catheter, that we pass into the uterine cavity and then inflate it. It will be there for some days, like 10 days. The essence of passing that intrauterine catheter is like a balloon. So it will just stay, the abdomen is there, so it will just stay inside the uterus. So by the time it stays inside the uterus, healing is taking place, fibrosis is taking place. So it prevents the collapse of the walls of the uterus. That's the anterior and posterior or lateral walls. So it stops them from coming together. Because it is when those walls come together and heal, then the endometrium will not be there. Then when that happens, the woman will not be able to see her menses again. Asherman syndrome. So from one problem to the other. But when you pass that intrauterine tube, you leave it there for some days. It helps to keep the endometrium. It helps to keep the walls apart. And another thing we can also do, there are some medications that we give, such as oral contraceptive pills, which is commonly available. It helps the regeneration of the endometrium. That endometrium that has been breached, it helps it to regrow very well. And that drug is taken for 3 months. So it helps the endometrium to regenerate so that the woman will still continue seeing her menses. So there are some fibrous surgeries that can be very difficult, very complicated, and in the process, the endometrium may be completely removed. It is when the endometrium has been completely removed and nothing is there, then such a person may not be able to see her menses again. So a woman that has done a myomectomy can still see her menses. It's just taking these necessary precautions, to be able to preserve and regenerate the endometrium. Thank you.
Zion, we move. My name is Grace Bassi. I'm from Akwa Ibom State. So I want to ask, is it normal for a lady to see her menstruation 2 times in a month? And during that 2 times, it comes 7 days. So 7 days, that is 14 days. And sometimes it doesn't come at all. And whenever it comes very heavy and flow fast.
Yeah, this is what we call abnormal uterine bleeding. Any bleeding that is not normal, that is outside the menses, in terms of flow, duration and all that, is called abnormal uterine bleeding. So it is not a normal thing. And there are different causes of this abnormal uterine bleeding. It can be fibroid, it can be hormonal imbalance, such as hyperprolactinemia, polycystic ovarian syndrome. So that is why you need to see a doctor. A doctor will see you, take history, carry out some investigations, review the results of the investigations, make a diagnosis, and then manage you to normalize things and to also help you when you want to get pregnant. Because a young lady may present with this hormonal imbalance. Her main worry is the fact that she's not seeing her menses normally, that her menses is not coming out regularly. So the management will be dependent on the desire for infertility. It will be dependent on wishes of the patient. So if a young woman presents with hormonal imbalance, the way you will be managed will be different. A woman that wants to get pregnant and a young lady that does not want to get pregnant, the management will be different. But the woman will not be properly counseled for her to know that when she now wants to get pregnant, if that pregnancy is not coming naturally, then you see a doctor that can assist you, that can help you with some fertility drugs, and then timed ovulation induction and timed intercourse to get pregnant. And if you want to be seeing your menses normally, because the young lady can have a psychological issues. She may just not be happy. She may be depressed that she's not seeing her menses. There are some medications that we can also give you that will help you to be seeing that monthly flow. And it also helps to reduce the thickening of the endometrium with its complications. So you'll be seeing your menses every month, and it reduces the complications, some of the long-term complications of the hormonal imbalance. So, and you'll be happy. So, yes, such conditions can be treated. Abnormal uterine bleeding. Thank you.
Zion, we move. I'm Christine Wachuku. My question borders on endometriosis. I want to put it this way. What is the aftercare or the best care to be given to someone that just had myomectomy and in the process endometriosis was handled? Because I learned it can recur. What is the best care to prevent that recurrence? And secondly, in a situation whereby after the surgery you bleed you bleed as though you have hormonal imbalance after the first 14 days. When you're supposed to be ovulating, you're bleeding. Then on your 26th day again, you're bleeding. Is it as a result of the hormonal imbalance, which had been earlier treated, or is it as a result of the myomectomy that took place not long? Thirdly, the ovarian reserve. I want to know if it is actually very healthy, because if one is induced to induce, does it affect the ovarian reserve of a woman such that after a number of trials, folliculometry, you are able to exhaust the whole eggs in your ovarian reserve? So is there any other natural method that can help instead of regular ovarian induction?
Okay, thank you. Before a woman is allowed to go for ovulation induction, that woman will be properly evaluated. So that's why you still need to see a gynecologist. A trained gynecologist will review you and know, with the test and other things, will know if you are qualified for fertility drugs, if you are qualified for that ovulation induction and timed intercourse. It's not something that is done casually. It is done with the aim of achieving conception. It's done with the aim to achieve conception. And it's also done with follicular tracking. You go for scan, they'll be monitoring the size of the follicles so that you'll be able to tell when it will likely rupture, when ovulation would have occurred. So it's something that is done in selected patients. That's why the gynecologist sees and reviews. So it's in selected patients. It is not all people, all patients that will qualify for that. That will qualify for that. And as after, ovarian reserve is also dependent on age. Young girls, young women will have better ovarian reserve than older women. So, and a woman has so many eggs in her reproductive age. And that is why when these eggs are not used, maybe for conception to occur, every month she will menstruate and the egg gets wasted. And that's why a woman can menstruate for almost 35 years before she reaches menopause. So they have enough that can be used for them to have their, to complete their family size, to have their, but in carefully selected patients are evaluated. Then endometriosis. Yes. Endometriosis, yes, it's quite, it's a common gynecological condition that we have. In the past, it used to be underdiagnosed. A lot of people actually had this condition, but the diagnosis was not being made. So it's now looked as if it was not common. Now, when a woman has had endometriosis and also has had a myomectomy, as you said, and all that, there are medications, there are drugs that can be given that will help to suppress ovulation. Because the problem with endometriosis is that every time the woman ovulates, the symptoms, the hormones are produced, the symptoms, those painful menses and all that comes up. So if you can suppress ovulation, you make the woman not to ovulate, the symptoms of endometriosis will reduce. So usually, when we see patients that have endometriosis and we've done surgery for, there are some drugs that we give them, gonadotropin-releasing hormone agonists. We give them these drugs, and they can take it for about 3 months. So what these drugs do is that these drugs will suppress ovulation for 3 months, about that period. So it reduces all the symptoms. So the woman will feel very relieved, because ovulation is not occurring. Do you understand? So she will feel very relieved, and it will help her condition. It will help to reduce the ascites and other things that can be associated with the endometriosis. So there are drugs that are used for treating ovulation. It's just that they are very expensive. They are very expensive, but there are drugs, and they are quite effective, but they are very expensive. Yes. Thank you.
Zion,
we move.
My name is Ada Onwuteaka, Deputy Director, Nursing Services. Mine is not just question, but to appreciate you. Chief, you really nailed the questions. So I want you to re-echo to the minds of couples here, because in here we have childbearing couples and parents with children, on the permanent effects of untreated ailments, especially moms in adults. Thank you.
Okay. All right. Thank you. Thank you, Matron. Thank you. Yes. As part of the causes of infertility, there are also conditions such as moms. Moms during childhood can cause infertility. Apocanti, that's what they call it in Igbo. Moms, you have swelling of the parotid glands, both of them. They are very serious medical conditions, and parents should make sure that when their children present with these moms, that they go to see doctors so that they'll be well treated. It's been found to be one of the documented causes of infertility in men, in males. Yes, it's been found to. So it's important that such conditions should also be treated, and every other condition should be treated. Thank you. All right. So in summary, infertility is a major issue, and it's defined as inability of a couple to achieve conception within 1 year following regular unprotected sexual intercourse. We have different causes. We have male factor causes, female factor causes, and idiopathic causes. So it's important that couples that have infertility, that they go and see the gynecologist early enough so that evaluation can be started on time. And for women that are above 35 years, they don't have to wait for 1 year before seeing a doctor. Once a woman above 35 years has tried getting pregnant for 6 months and it has not occurred, then you should go and see a doctor. It's a global issue. It's a global issue, but it's a good thing that new trends, the current trend, there are a lot of fertility drugs and assisted reproductive techniques that have helped women, that are also helping women with infertility issue to achieve conception. Prevention is very important. It's important for us to prevent the causes of infertility, keeping to one sexual partner, and treating sexually transmitted infections, diseases, pelvic inflammatory diseases, and going to doctor for proper evaluation. Thank you.
Okay, so guys, you have watched this video. This is very educative. This is very informative. And a lot of men will not come out to ask questions. My concerns are men. Men, you will not come to ask questions. And you not coming to ask questions doesn't give you freedom. Ignorance. If you listen fervently well today, you realize that a lot of men, a lot of women were ignorant. And you're not going to blame them. And some of these things are caused by, oh, I will do it tomorrow, I will do it next tomorrow, accumulated infections. All this whole thing. You are too busy to go and check up of yourself. The person that built the hospital, they build it for a purpose. It's for you to come and check. Go and check. Stress alone, men go through now, can even reduce your lower sperm. Stress. The way this country is going alone. So please, don't take your health for granted. This program, I know by now, Holy Ghost Court next week Tuesday will full. Because a lot of people have questions. A lot of people have unanswered questions. A lot of people are disturbed with questions. A lot of people are disturbed with what they are going through. And it's not easy. But right now, the man of God have differentiated spirituality and physicality. So those of you that have been dragging him, you will not see this once and post. Those of you that have been talking all sorts of things you want to say. Now, he is now making it the job easy. So there are some jobs that are spiritual. There are some jobs that are physical. So the physical aspect, now, the medical department is taking care of it. Please, I'm begging you in the name of God. And you know, most of us men, it's difficult for us to go to the hospital because you will just feel that you are too busy. You are too busy. Any small thing, you're tired. You climb staircase, you're tired. You do this, you do that, you're tired. Or go hospital. Sometimes there are some things that you would have been taking care of, that would have taken care of like 5,000 naira if you had gone to do it early. But because of accumulation, it's still longer. And you now spend that 5 million. If only you could go to spend it. Please, I'm begging. We've learned. God bless you, Evangelist Chukwu Ebukano, as you before, what God is using you to do, because man, it's rare to see this kind of thing. And you know, Zion is real. It's not where you come and paint word. It's been spoken the way it is. If you learned something on this video, you've been educated and able to share this video, like, drop your comments. You also that want to ask questions home, you have questions to ask, please drop the question on the comment section. Maybe a gynecologist can be able to answer you, or a medical doctor, or a medical practitioner. Who knows? This lady might see it and also answer you. All right. Thank you very much for watching. My name is MC Hallelujah. Make sure you subscribe. Ngokbala is coming, and so you'll be getting more updates. Bye bye.